Welcome to the Deep Dive. This is where we take a stack of source material articles, research, reports, notes, and really drill down to extract the most important insights, giving you a shortcut to being truly well informed on a fascinating subject. Today, we're plunging into a critical and rapidly evolving area, the intersection of artificial intelligence, or AI, and trauma surgery.
It certainly is. It's a field defined by, well, urgency, isn't it? By life or death decisions made under pretty extreme pressure. Bringing cutting-edge technology like AI into this environment holds extraordinary potential, but sure, it also presents some quite unique challenges.
Absolutely. And our deep dive today is specifically guided by insights from a really comprehensive report titled Artificial Intelligence in Trauma Surgery: Reality, Potential, and Impact. Our mission really is to unpack this report for you, exploring AI's current role, its concrete benefits, the significant hurdles it faces, and, I suppose, where experts see this technology heading in the future of trauma care. So consider this your essential briefing on how AI is beginning to transform one of the most high-stakes medical specialties out there.
That's a good way to put it. Trauma surgery just doesn't afford the luxury of time, does it? You're dealing with critically injured patients, often incomplete information, and immediate decisions that have, well, profound consequences. This report really lays bare how AI is starting to enter that sort of chaotic, high-pressure world, not just as some futuristic concept, mind you, but as tools that are actively being developed and in some cases already being implemented. It really highlights the complexities, of integrating advanced tech into a system where human expertise and rapid response are absolutely paramount.
It's certainly a dramatic setting for technological integration. Okay, let's unpack this report by first grounding ourselves in some history. AI in healthcare has been around for a while in various forms, hasn't it? But applying it specifically to the sheer intensity of trauma surgery feels like a more recent development. Can you walk us through that evolution a bit?
You're right. The broader history of AI in healthcare is fascinating, and it actually stretches back further than many people might think, though. Widespread practical application is definitely newer. Its growth has been intrinsically linked to two pivotal developments over the past few decades. Firstly, the exponential increase in computational power, just the raw ability of computers to process vast amounts of data at incredible speeds. And secondly, the explosion of what we now call big data. Healthcare, as you can imagine, generates absolutely prodigious amounts of data. Electronic health records, medical imaging, genetic sequences, data from monitoring devices, even administrative data. You see, AI algorithms need powerful hardware and enormous data sets to learn patterns and make predictions effectively. Without both, early AI in medicine remained largely theoretical or perhaps limited in scope.
Right. So when AI first started making inroads into medicine, where did it show up specifically in areas related to surgery? Was the focus on trauma straight away, or?
No, not at all, actually. The initial surgical applications were much less about that real-time critical decision-making that you associate with trauma. They were more focused on, shall we say, structured tasks, things like imaging analysis and preoperative planning. Early efforts involve things like automated feature detection and scans, essentially training algorithms to spot specific anatomical landmarks or perhaps anomalies, potential pathology in X-rays or CT scans, that sort of thing. Then came computer-assisted interventions, primarily designed to help surgeons plan complex procedures. Software could take imaging data, build a 3D model, allowing surgeons to, rehearse steps, identify potential challenges, determine the optimal surgical approach before they even made an incision.
Ah, okay. So planning and visualization.
Exactly. And some early AI was also used for intraoperative guidance,
Right.
maybe overlaying imaging onto the surgical field to provide navigation cues during the operation itself. These were valuable tools, no doubt, but they operated in a more controlled, less chaotic environment compared to, say, an incoming major trauma case.
That makes a lot of sense. It sounds like the focus was on augmenting visualization and planning capabilities. Important, yes, but quite different from the kind of urgent assessment and prediction needed in trauma, isn't it?
Precisely. These early applications laid important groundwork, familiarizing surgeons with using computer assistance. But as AI technologies matured, particularly with the rise of machine learning and, more recently, deep learning, these are powerful subsets of AI capable of learning directly from raw data without explicit programming. The potential applications just expanded dramatically. AI moved beyond static image analysis or navigation. It became capable of really complex pattern recognition, risk stratification that's identifying patients most likely to experience a particular outcome, predictive analytics, forecasting future events based on current data, and of course the aspiration of personalized or precision medicine, tailoring treatments to an individual patient's unique profile.
And that's the capability set that starts to become incredibly relevant for trauma. Because trauma is fundamentally about assessing immediate risk, isn't it? Trying to predict outcomes under huge uncertainty and providing highly individualized urgent care based on a unique constellation of injuries and patient factors.
Exactly right. The first significant strides in using AI specifically in trauma settings leverage these newer predictive capabilities. Initial applications involve developing models to assess injury severity almost immediately upon patient arrival and, crucially, predict patient outcomes, things like likelihood of survival, the need for specific interventions, or potential complications down the line. AI algorithms could analyze vast amounts of diverse clinical data gathered quickly in the emergency department, demographics, vital signs, specific injury patterns documented in the trauma bay, initial lab results, you name it. By comparing this against patterns learned from millions of previous trauma cases, these algorithms could provide rapid insights, allowing trauma teams to better anticipate a patient's likely clinical path and needs.
So the evolution really went from planning tools to predictive tools, explicitly selected for the unique, time-sensitive challenges of the trauma context. And the report points out quite a significant surge in interest in this area over just the last decade or so.
Yes, that's very clear. There's been a palpable and marked increase in both research interest and practical application focus on AI within emergency medicine and trauma, certainly over the past 10 years. This growing recognition of AI's potential within the acute care setting prompted various initiatives. One notable example mentioned in the report is the ARISE survey, that stands for the Artificial Intelligence in Emergency and Trauma Surgery Survey. This was a large-scale effort to specifically gauge acute care surgeons' existing knowledge about AI, their attitudes towards adopting it in urgent settings, and their perceived readiness for integrating these technologies into their practice. The very existence and, indeed, the findings of a survey like ARISE underscore that AI in trauma has moved from being a sort of niche academic exploration to a topic of mainstream professional discussion and growing recognition within the surgical community itself.
And it's clear this hasn't been a siloed development. Throughout its history, it seems it's required different fields working together.
Oh, absolutely. This history is fundamentally interdisciplinary. It's not just surgeons deciding they need AI or computer scientists building algorithms in isolation. Not at all. It's built on deep collaboration and sometimes, let's be honest, challenging communication between healthcare professionals, trauma surgeons, emergency physicians, nurses, radiologists, computer scientists who develop the algorithms, data analysts, and statisticians who handle the data and validate the models, and increasingly, ethicists and human factors experts as well. No single group possesses all the necessary knowledge to make these tools effective and safe in the real world of trauma. It requires truly understanding both the complex clinical workflow and the technical possibilities and limitations of AI.
It's fascinating to see how AI has evolved from sort of aiding visualization and planning to becoming a potential partner in predicting critical outcomes in the most challenging situations. So that lays out the historical path nicely. Where are we now? What are the concrete current applications of AI that the report highlights as being integrated into, or at least actively explored within, trauma surgery practice today?
Well, AI has already started to be integrated into various points along the trauma care pathway, even if it's not yet universal across the board. The report makes it clear it's not just one sort of killer app, it's more a suite of tools touching different aspects of practice.
Okay, let's start with something fundamental, managing knowledge. Trauma surgery demands that practitioners stay current with just an overwhelming amount of medical information, doesn't it? How is AI helping there?
That's a crucial entry point, actually, because the sheer volume of new medical research, constantly updated clinical guidelines, specific protocol changes, it's simply impossible for any single human practitioner to absorb and keep pace with entirely. So AI-driven platforms are emerging as incredibly valuable educational and knowledge management tools. They help practitioners filter and assimilate this vast amount of medical information. Specifically, AI can assist in curating highly relevant literature, research findings, and current resources tailored to a surgeon's specific needs or perhaps a particular type of trauma case they're facing. It effectively streamlines their continuous learning processes.
So instead of spending hours manually searching through massive databases for the latest paper on managing a specific injury, AI can potentially surface it almost instantly.
Precisely. Or at least much, much faster. It allows for quicker, more targeted access to critical information that can directly inform decisions in the clinic or the operating theater, ultimately influencing patient outcomes. Think of it as having an incredibly fast, hyper-focused research assistant who can, metaphorically, digest the entire medical library and pull out exactly what you need right when you need it. This is particularly valuable in trauma, where protocols and best practices can evolve quite rapidly, and a surgeon might need to quickly consult the latest evidence on a rare or perhaps complex injury pattern.
Okay, beyond helping surgeons stay informed, how is AI impacting the actual workflow in a busy trauma center, the day-to-day operations?
Workflow optimization is a major area of focus for current AI applications. The goal, really, is to design AI systems that fit as seamlessly as possible into existing clinical workflows. You want them to be intuitive, minimal disruption. However, the report strongly emphasizes a critical point here: the need for continuous monitoring of how these AI implementations are actually being used in practice. It's not enough just to install the software, you see. You need to ensure it's being used correctly, integrated properly into team dynamics, and crucially, identify any areas where it might be creating bottlenecks or confusion. This includes regular evaluations of clinician engagement, understanding if the surgical teams are actually using the tools consistently, if they trust them, if they find them helpful, or are they bypassing them because they're clunky or don't quite fit how they actually work at the coalface.
And does the report give a concrete, perhaps compelling example of this workflow optimization in action?
Yes, it does. There's a very powerful example specifically related to imaging analysis. AI algorithms are being used to analyze medical images, things like CT scans of trauma patients, to help prioritize cases and identify critical findings more quickly. The report cites some really impressive results where AI has drastically cut the time radiologists or trauma teams spend on that initial image evaluation. What might traditionally take potentially hours for a comprehensive human review can apparently be reduced to just minutes using AI pre-screening, while, and this is crucial, maintaining a high level of accuracy.
Hours to minutes. Wow.
Hmm.
In trauma, where speed is absolutely everything, that sounds like a potential game changer. Getting that critical information about internal injuries significantly faster must make a huge difference.
It really does. That reduction in time is a tangible, impactful detail that illustrates the practical benefits of AI in the workflow. That speed means diagnoses can be confirmed more rapidly, allowing treatment plans to be finalized and interventions initiated much, much sooner, which can directly impact patient survival and recovery.
And that speed in analysis flows directly into supporting decision-making, presumably. How does AI enhance the surgeon's ability to make those complex decisions under immense pressure?
Well, AI enhances decision-making by providing essentially real-time analysis and synthesis of vast amounts of patient data. This goes beyond just imaging. It includes pulling in a patient's relevant medical history, any pre-existing conditions, their current vital signs, lab results, diagnostic imaging, often integrating these different data streams faster than a human team could manually collate them, especially under pressure. This integrated approach can also present surgeons with up-to-date surgical guidelines and relevant research insights specific to the patient's injuries or profile, potentially even during the procedure itself via, say, in-OR displays.
So it's not just presenting raw data, it's synthesized data, contextualized with the latest knowledge. Is that the idea?
That's exactly the idea. This capability enables a level of personalization in patient care that is incredibly challenging to achieve manually, especially in the rushed environment of trauma resuscitation. AI systems can analyze the unique combination of factors for an individual patient and, based on patterns learned from millions of other cases, perhaps suggest specific diagnostic tests that might be warranted, or even recommend potential medications or management strategies based on that comprehensive data analysis. The potential here is significant for improving patient outcomes by ensuring decisions are informed by the fullest, most current picture possible, really tailored to that specific patient in that specific moment.
And AI is also playing a growing role in assessing risk, which is absolutely fundamental to trauma care, isn't it?
Yes, AI's role in risk assessment and outcome prediction is certainly one of its most promising current applications. It really leverages the power of large patient databases and national trauma registries, aggregating de-identified data from countless previous trauma cases. The report mentions specific tools that are either in use or in advanced stages of development. Things like the ACS NSQID IP Surgical Risk Calculator, that's from the American College of Surgeons National Surgical Quality Improvement Program, and also the MySurgery Risk Algorithm. These tools use AI and machine learning to evaluate a patient's likelihood of specific postoperative complications based on their individual characteristics, comorbidities, the type and severity of their injuries, and of course the planned surgical interventions.
So these aren't just abstract concepts anymore. These are becoming actual tools used to provide quantitative estimates of risk for real patients in the hospital.
Correct. These predictive algorithms are designed to be crucial tools for enhancing surgical planning, for setting realistic expectations for patients and their families, and also for assisting with resource allocation within the hospital itself. But the report rightly highlights that the accuracy and, importantly, the fairness of these tools rely heavily on being trained and validated using diverse, high-quality data inputs. This is absolutely essential to ensure they work effectively and equitably across a wide demographic range of patients and account for variations in injury patterns and patient populations. Data quality isn't just a technical detail here. It directly impacts the reliability and the clinical usefulness of these risk assessments.
Okay, so looking at current applications, AI is being integrated now in these crucial areas, helping surgeons manage overwhelming knowledge, significantly optimizing key workflows like imaging analysis, providing sophisticated data-driven decision support, and enabling more precise risk assessment. That covers a really broad spectrum of potential impact. Let's delve deeper now into the tangible benefits of these applications. What are the key advantages that AI actually brings to the table in trauma surgery, according to the report?
Well, the primary overarching benefit, especially resonant in the context of trauma, is definitely the enhancement of decision-making quality and speed in those incredibly high-pressure, time-sensitive situations. As we've discussed, emergency surgeons have to rapidly process vast amounts of clinical and radiological data coming at them simultaneously, often in a pretty chaotic environment. AI helps them do this by quickly processing, synthesizing, and presenting that information in a more digestible format, enabling them to make more informed decisions faster than would otherwise be possible. This rapid, data-backed decision-making has the potential to lead directly to better clinical outcomes for the patient.
So it helps cut through the inherent noise and uncertainty of a trauma bay, allowing them to focus on the truly critical information.
Precisely. It augments the surgeon's cognitive ability to synthesize complex, dynamic information under extreme duress. It potentially reduces cognitive load and, hopefully, the chance of overlooking something critical. Another major benefit, which flows directly from the current applications we just talked about, is the sheer power of predictive analytics.
Right, the prediction side. Tell us more about how those predictive capabilities specifically benefit trauma care in a potentially life-saving way.
Predictive analytics in trauma can quite literally provide early warnings. Algorithms can forecast not just the general likelihood of complications, but also the specific risk of mortality for a given patient based on their initial presentation. The report provides a really compelling example with the Trauma Outcome Predictor, or TIOP algorithm. This algorithm utilizes a combination of readily available data points upon patient arrival, things like demographic data, initial vital signs, and detailed characteristics of their injuries documented by the trauma team. It uses these to forecast both mortality and other potential complications, like, say, acute kidney injury or sepsis. And the report highlights its effectiveness by citing some impressive performance metrics, specifically high C-statistics reaching up to 0.941.
Okay, you mentioned the C statistic there. Just to reiterate for us, what does the E statistic of 0.941 actually tell us about the TIOP algorithm's performance? How good is that?
Right, so a C-statistic, or concordance statistic, essentially measures the discriminative power of a predictive model. For a binary outcome like survival versus mortality, a C-statistic of 0.05 means the model is basically no better than random chance at predicting the outcome. A value of 1.0 represents perfect prediction. So a C-statistic of 0.941 is remarkably high. It indicates that the TIOP algorithm is extremely good at distinguishing between patients who are likely to survive and those who are not, based on the initial data it receives. This level of accuracy means the predictions are clinically meaningful and, reliable enough to inform critical decisions.
That's an incredibly powerful piece of information to have when a patient's life is literally on the line. How does a trauma team actually use that prediction in practice?
Well, it's crucial to understand it's not about replacing clinical judgment. Not at all. It's about augmenting it. Knowing a patient has a statistically very high predicted mortality risk allows a trauma team to perhaps have immediate, difficult, but necessary conversations with the patient's family. It informs decisions about the aggressiveness of interventions, the allocation of scarce intensive care resources, and it shapes the overall management strategy right from the outset. Conversely, identifying patients at lower risk overall, but perhaps with a high likelihood of specific complications, allows for proactive management to try and prevent those complications from ever developing. These tools help trauma teams quickly stratify patients, ensuring those most in need of immediate, aggressive intervention are identified without delay, while also optimizing care for those with complex, but potentially less immediately fatal injuries.
You also highlighted enhanced diagnostic accuracy earlier, particularly with imaging. How does AI's ability to analyze scans faster and perhaps more reliably translate into a direct benefit?
Well, machine learning techniques, particularly these deep learning models trained on vast image datasets, are proving highly effective at identifying subtle signs of trauma in imaging tiny fractures, internal bleeding, organ damage, sometimes more reliably or faster than human eyes alone, especially in complex scans or perhaps when the reviewer is under fatigue. This improved accuracy is a significant benefit in itself. But what's potentially even more transformative is the possibility for AI to support early detection, even before the patient physically arrives at the hospital. So if initial imaging is performed perhaps by paramedics en route or at a smaller referring hospital, AI algorithms can analyze these scans and relay crucial findings to the receiving trauma center almost instantly.
The detection and analysis before arrival, that really does sound like something out of, well, a medical drama, as you say.
It's becoming a reality, driven by AI. And in trauma care, where definitive treatment for conditions like internal hemorrhage or severe brain injury is so critically time-dependent, early detection means earlier interventions. It's that simple. If the trauma team at the receiving hospital knows, based on the AI's analysis of the en route scan, that the patient has a likely arterial bleed or perhaps a tension pneumothorax, they can have the surgical team ready, the operating room prepared, the necessary equipment lined up, and waiting the moment the patient rolls through the door. This saves precious minutes, which, as we know, can absolutely be the difference between life and death, or between good recovery and severe disability.
Beyond the direct clinical care of the patient, does AI offer benefits on the operational side, managing the hospital's resources, for instance?
Absolutely, and this is a significant area of benefit for the healthcare system as a whole. AI's ability to analyze historical trauma patterns, perhaps combined with predictive modeling based on factors like time of day of the week, maybe even local events like festivals or football matches, can help predict trauma volume and acuity. That means estimating how many trauma patients are likely to arrive and how severe their injuries might be. This predictability allows hospitals to allocate resources far more efficiently than relying on, say, static staffing models.
So the hospital can staff trauma bays, operating rooms, and ICUs more appropriately based on predicted need rather than just guessing or sticking to a fixed rota.
Exactly. Better allocation of staffing levels, ensuring the right equipment is available and functioning, optimizing the availability of operating rooms and critical care beds based on predicted demand. All of this can lead to significant cost savings for the hospital system by reducing unnecessary standby costs, or perhaps expensive overtime. And crucially, it also leads to improved patient outcomes because the necessary resources are more likely to be available immediately when a critical patient arrives. There's no delay scrambling for staff or equipment. Furthermore, AI can assist in adapting electronic health records, EHR, and reporting systems to facilitate more seamless, real-time data collection and integration from various sources, ambulances, labs, imaging departments. This enhances the overall efficiency and responsiveness of the entire trauma care system.
We've touched on it multiple times now, but is the fostering of interdisciplinary collaboration itself considered a benefit of introducing AI?
Yes, I think it is. The necessity of deep interdisciplinary collaboration isn't just a requirement for success, it's actually a benefit in terms of driving innovation and ensuring the tools developed are truly fit for purpose. Integrating AI into trauma surgery demands close working relationships among clinicians from various specialties, computer scientists, data scientists, engineers, ethicists, the list goes on. This forces professionals from different domains to understand each other's language, priorities, and constraints. This kind of cross-pollination fosters innovation and, critically, leads to the development of AI tools that are not only technically powerful, but also interpretable and user-friendly for the clinicians who need to use them in a high-stakes, high-pressure environment.
Interpretable. What does that mean exactly in the context of a surgeon using an AI tool in the middle of a crisis?
It means the AI doesn't just give a kind of black box answer, like patient X has an 80% risk of complication Y. An interpretable AI system ideally can provide some insight into why it arrived at that prediction or recommendation. It might indicate which specific patient factors or data points weighed most heavily in its analysis. This is absolutely vital for building clinician trust and encouraging adoption. If a surgeon understands the reasoning behind the AI's suggestion, they can integrate it much more effectively with their own clinical expertise and contextual understanding of the patient, rather than having to blindly trust or conversely dismiss a recommendation they don't understand. Ensuring these tools are intuitive, reliable, and interpretable is absolutely key to successful integration and genuinely transforming how trauma surgery is planned and executed.
So, AI brings truly significant potential benefits. Sharper, faster decision-making under pressure. powerful, accurate prediction of outcomes and complications, enhanced diagnostic speed and accuracy, potentially even before patient arrival, optimized resource management for the hospital system, and the vital fostering of interdisciplinary collaboration. That paints a very positive picture indeed. But as with any transformative technology, it's clearly not without its significant hurdles, is it? What are the major challenges and limitations preventing widespread, seamless AI adoption in trauma surgery right now?
You're absolutely right. While the potential is clear, the path to widespread implementation is definitely complex and faces some pretty significant barriers. The report dedicates considerable attention to these hurdles, and they are multifaceted, touching on technology, finance, data, and perhaps most importantly, the people involved.
Let's start with that human element and some of the non-technical concerns, like the ethical considerations. The report mentions fears around sort of depersonalization.
Yes, ethical considerations are a prominent discussion point, and rightly so. There is a genuine concern among some healthcare professionals and ethicists that an over-reliance on AI, which typically operates on aggregated data patterns derived from large populations, could inadvertently lead to a depersonalization of individual patient care. The worry is that the focus might shift too much towards statistical probabilities and away from the unique human story, the values, the preferences of the individual patient sitting right there in front of you. Additionally, there's the element of patient and family hesitation. How comfortable are individuals and their loved ones receiving highly sensitive information, like a statistically calculated prediction of a very low chance of survival, delivered by or heavily influenced by an algorithm? This is a profound question. Addressing these deep ethical dilemmas, ensuring transparency in how AI is used, and crucially, maintaining human oversight are vital for building and maintaining trust both between patients and their care teams, and indeed between clinicians and the AI tools themselves. If these concerns aren't proactively and carefully addressed, they can become significant barriers to adoption.
And beyond the ethical side, what about the purely practical barriers? Getting these systems installed, integrated, and actually used consistently in a busy, often frantic hospital environment.
The practical implementation barriers are substantial, make no mistake. A major one is the need for robust, real-world evidence demonstrating the clear value of any given AI system in a live clinical setting. It's simply not enough for an algorithm to perform well on a historical dataset in a research lab. It needs to prove its worth in the chaotic, high-pressure environment of a real trauma center. It needs to show it actually improves outcomes, or saves time, or reduces costs without adding undue burden or new risks. This requires rigorous prospective studies, which are expensive and time-consuming. Furthermore, implementing AI requires clear, ongoing communication about its specific benefits, but also, crucially, its limitations and potential weaknesses. We need to manage clinician expectations realistically and encourage sustained, appropriate use, not over-reliance or complete dismissal. Continuous training and education for all staff who will interact with the AI system are also absolutely vital and frankly challenging to maintain given the typical staff turnover rates in healthcare. If new staff aren't properly trained on how to use the AI tools or perhaps don't understand their outputs, utilization becomes inconsistent, and that undermines the whole system's potential benefits.
And I imagine once it is implemented, ongoing support must be absolutely necessary too. You can't just install it and walk away.
Absolutely critical. Establishing robust support mechanisms is essential. This means having dedicated IT support or help desks specifically for the AI systems who understand the clinical context. It also means having internal governance committees. These committees are crucial for overseeing the AI's ongoing performance, addressing operational queries, troubleshooting technical issues, and ensuring continuous assessment of the AI system's effectiveness, its adherence to protocols, and its real impact on clinical workflow and patient care. Without that support infrastructure, adoption will inevitably falter.
The report also touches on the financial and regulatory landscape. Medical technology is notoriously expensive to bring to market and get approved, isn't it?
Yes. Financial resources and regulatory hurdles present significant challenges that definitely slow down progress in this area. The cost associated with gaining regulatory approval for medical AI systems is substantial. This involves extensive documentation, rigorous testing, and validation processes to demonstrate safety, efficacy, and compliance with complex medical device regulations, which differ across jurisdictions. These costs can be prohibitive for smaller companies or academic groups and significantly slow down the commercialization and scaling of promising AI solutions. Many innovative AI applications originating in academic research labs, despite showing great potential, really struggle to attract the necessary funding to navigate this expensive and lengthy regulatory landscape and make the transition into widespread clinical use. Lack of funding often keeps valuable tools confined to pilot studies or research phases, unfortunately.
And the very fuel for AI, the data itself, presents its own set of problems, doesn't it? You mentioned data quality earlier.
Data quality is not just a challenge. It is arguably the most fundamental requirement and often the biggest headache. AI is only as good, only as reliable, as the data it learns from. Simple as that. Healthcare data is frequently, well, messy. It can be unstructured, like dictated clinical notes. It can be incomplete, inconsistent in formatting across different departments or hospitals, or even contain outdated information. These variations and imperfections make training robust, reliable AI models incredibly difficult. Furthermore, interoperability issues between disparate hospital information systems and electronic health records are a massive, persistent problem. Data silos exist everywhere. Getting all the necessary relevant information about a single patient to feed into an AI model might require cumbersome manual processes involving logging into multiple different systems, copying and pasting.
Which completely undermines the AI's supposed goal of improving efficiency and speed.
Exactly. It's counterproductive. If clinicians have to spend more time manually wrangling data for the AI than it saves them elsewhere, adoption will understandably plummet. They'll just revert to their old ways. And this directly connects to the challenge of change management and adapting existing workflows. Introducing complex AI tools often requires significant changes to deeply ingrained routines and established processes within the trauma bay and throughout the hospital.
And asking healthcare professionals who operate in incredibly high-stakes environments with often well-honed, trusted protocols to change how they fundamentally work can face significant resistance, I imagine.
Precisely. Healthcare professionals are trained and accustomed to specific, reliable methods. Substantial workflow changes, particularly if they aren't perceived as intuitive or genuinely beneficial, can easily be seen as just added burdens in an already incredibly demanding job. This naturally leads to pushback and resistance to adoption. Effective change management strategies are therefore absolutely essential to overcome this. This isn't just about issuing a new protocol memo. It requires clear, compelling communication about why the changes are necessary, what specific benefits they bring, and crucially, involving the clinicians themselves, the end users in the design, testing, and implementation process. If they have input, if they feel a sense of ownership, then acceptance and successful adaptation are far more likely.
And finally, training and ensuring competence with the technology seems like an ongoing barrier as well. Not everyone starts with the same baseline level of technical literacy, do they?
That's a very real factor identified in the report. There's often a significant disparity in IT skills and general knowledge levels among staff across different age groups, professional roles, and even departments. A lack of foundational technical skills, or perhaps unfamiliarity with data analysis concepts, can lead to misunderstanding AI outputs, misinterpreting predictions, or simply not knowing how to use the tool effectively or troubleshoot basic issues. This lack of understanding can critically undermine clinician confidence in relying on AI tools for important clinical decisions. So, continuous, targeted training programs that address these disparate skill levels and focus on both the technical use and the clinical implications of AI are vital. We need to ensure all staff are equipped to effectively engage with and, importantly, trust these evolving technologies.
So, while the potential benefits of AI in trauma surgery are clearly compelling and potentially life-saving, the path to widespread effective adoption is undeniably complex. It's fraught with ethical considerations, practical implementation hurdles, financial and regulatory challenges, significant data quality and interoperability issues, the crucial human element of change management, and the ongoing need for robust staff training and support. It really is a formidable balancing act between innovation and practical reality.
It absolutely is. The report makes it very clear that overcoming these challenges requires as much focus, if not arguably more focus, than developing the clever AI algorithms themselves. It's very much a socio-technical challenge, not just a purely technical one.
Right. Given these challenges and benefits, it's incredibly helpful to look at how AI is actually being explored and integrated in real-world settings right now. Let's turn to some case studies and examples mentioned in the report. How are institutions actually putting AI to work in trauma care, and perhaps what are they learning along the way?
Yes, case studies are invaluable for illustrating how theory meets practice, aren't they? And for highlighting focused efforts to implement AI, despite the challenges we've just discussed. A prominent example mentioned is the collaboration happening at St. Michael's Hospital in Toronto.
Right. St. Michael's is a major level 1 trauma center, isn't it? Handling some of the most complex and severe cases.
Precisely. They are very much at the forefront, having partnered with Unity Health's applied AI team to develop and implement various AI tools specifically aimed at improving care for trauma patients. One particularly significant focus of their work, highlighted in the report, is developing AI models to predict the necessity for surgery, specifically in cases of traumatic brain injuries, or TBIs.
And TBIs are, unfortunately, a major component of severe trauma with outcomes that can be incredibly difficult to predict, even for experienced clinicians.
Critically so. TBIs are a leading cause of death and long-term disability, particularly among young people globally. And deciding whether and when to operate can be incredibly complex, often involving balancing multiple risks. Research like this at St. Michael's, using AI to analyze detailed patient data, imaging features, maybe even physiological trends, reflects a concrete commitment to tailoring individualized treatment plans for TBI patients based on granular, data-driven insights. This is seen by many as a crucial next step in advancing trauma resuscitation and ongoing management, moving away from perhaps more rigid, one-size-fits-all protocols towards more personalized urgent care strategies based on AI-assisted prediction.
You mentioned the power of big data earlier. Are there examples of institutions or perhaps research efforts leveraging these large data sets and machine learning to improve surgical outcomes more broadly across trauma?
Yes, the report references the critical role being played by big data management and the application of machine learning algorithms in optimizing surgical outcomes for trauma patients. This is often highlighted in systematic reviews of the existing literature. These efforts typically focus on extracting and analyzing pertinent data sets from very large patient cohorts, drawing on national or regional trauma registries, which pool data from many hospitals, or sometimes massive local hospital databases compiled over many years.
And how does analyzing those huge aggregated data sets actually help improve surgery on the ground?
Well, by applying machine learning techniques to these vast data sets, researchers can potentially identify subtle patterns, correlations, and predictors of outcomes or complications that might not be obvious from smaller studies or even individual clinical experience alone. Comparing findings across various registries and local data sets, as highlighted in systematic reviews, allows for more robust validation of these insights. This data-driven approach enhances surgical quality control, provides benchmarks for performance, and informs the development of evidence-based clinical practices and guidelines that are hopefully more refined and effective. It really underscores the immense power of leveraging large-scale data to derive insights that can directly improve the efficacy and safety of trauma surgery procedures across diverse patient populations.
And that fascinating idea you mentioned earlier, AI providing information about patients before they even arrive at the hospital door. Are there real-world initiatives exploring that capability?
Absolutely. AI-driven predictive analytics for en route patients is a really powerful application being explored to transform trauma system responsiveness. By integrating data collected by paramedics in the field, perhaps initial vital signs transmitted wirelessly, observed injuries documented on a tablet, patient demographics AI algorithms can process this information while the ambulance is still transporting the patient. This allows the receiving trauma center to potentially receive detailed information and predictive insights about the patient's likely injuries and severity minutes before they physically arrive.
How does that advance warning actually change operations at the hospital? What difference does it make?
Fundamentally, it changes the trauma activation protocol. Receiving centers can use this AI-provided intelligence to effectively allocate critical resources in anticipation of the patient's arrival, rather than reacting after they get there. They can potentially make more informed decisions about preparing specific operating rooms for likely surgical interventions, assembling the necessary surgical and medical staff teams with the relevant expertise, and ensuring specialized equipment like blood products or specific implants are ready before the patient is even off the ambulance stretcher. This capability, obviously facilitated by seamless real-time data collection and integration with compatible electronic health record systems, could significantly enhance the responsiveness and efficiency of the trauma system, ensuring care delivery is faster and more targeted right from minute zero.
That proactive preparation, powered by AI prediction, must be a truly significant leap forward in such a time-critical environment.
It absolutely is, potentially. It shifts the paradigm from purely reactive response to a more proactive readiness. And finally, it's important to remember, these advancements don't happen in a vacuum. Collaborative research initiatives are essential drivers. The University of Texas at San Antonio, UTSA, is presented in the report as a key example of this kind of interdisciplinary collaboration.
Okay, what are they doing specifically down there?
Well, UTSA has established the Matrix AI Consortium, which is specifically focused on developing AI tools and solutions tailored for trauma care applications. The report mentions that their work has attracted significant investment, including apparently a recent $1 million grant to further their research in this area. Their explicit goal is not just to create AI solutions that improve clinician decision-making in trauma, but also, importantly, to consciously address potential healthcare disparities. They're working to ensure that these AI tools benefit all patient populations equitably, regardless of socioeconomic status, race, or geography.
That focus on equitable access and avoiding the risk of exacerbating existing disparities is such a crucial point, isn't it? Especially when dealing with vulnerable trauma patients from all walks of life. These case studies really demonstrate that AI in trauma surgery is moving from theoretical potential to focused, real-world exploration and implementation, tackling specific challenges head-on.
They certainly illustrate the current landscape, yes, highlighting the focused efforts underway and pointing toward the future potential that is actively being pursued. And they all emphasize the indispensable role of ongoing research and that deep interdisciplinary collaboration we keep coming back to.
So that brings us naturally to looking ahead. Based on the report, what are the key future directions for AI in trauma surgery? Where is all this innovation and development ultimately leading?
Well, the potential for AI to fundamentally transform patient care in trauma is clearly immense. But as we've discussed at length, realizing that potential really hinges on actively addressing the significant implementation challenges we've outlined. So the future direction involves both advancing the technology itself, making it smarter and more capable, and also diligently tackling the very real hurdles to adoption.
What kind of advancements can we realistically expect to see in the AI technology for trauma specifically in the coming years?
We can certainly anticipate continued advancements in the sophistication and capability of AI algorithms. Future research will likely refine these models to analyze increasingly complex and dynamic data sets, moving beyond static images and initial vital signs to incorporate perhaps continuous physiological data streams from bedside monitors, maybe even genetic information influencing patient response to injury or treatment, detailed real-time responses to initial treatments, and potentially even data from wearable sensors applied early on. The goal remains the same: to support faster, more precise, and even more informed decisions by integrating a richer, more complex, more dynamic picture of the patient's status over time.
And that exciting possibility you mentioned earlier, AI potentially helping during the actual surgical procedure itself, is that science fiction or a real prospect?
Oh, it's a very real area of future development. Researchers are actively working towards developing AI systems capable of learning not just from pre-hospital or initial hospital data, but from real-time data collected during surgery itself. Think about video feeds from laparoscopic cameras, telemetry data from surgical robots, continuous patient monitoring data in the operating theater. The vision is for AI to provide surgeons with predictive insights live in the operating room. Imagine an AI analyzing the surgical field, the patient's vitals, the progress of the operation, and predicting potential complications, things like excessive blood loss, impending organ ischemia, or subtle signs of physiological decompensation perhaps as they're occurring, or even slightly before they become clinically evident to the human team. This kind of intraoperative predictive support could dramatically help surgeons anticipate and mitigate complications in real time, potentially improving patient outcomes significantly.
That truly sounds like the future of surgery, doesn't it? And you mentioned that addressing the implementation barriers must be a core part of this future direction. It's not just about the tech.
Absolutely essential. Future efforts and investment must actively focus on overcoming the challenges we discussed earlier. Resolving concerns around clinician liability when using AI recommendations, for example. Simplifying and integrating AI into complex existing hospital workflows, not disrupting them. And, critically, achieving true seamless interoperability between diverse hospital IT systems so that data flows freely and reliably to fuel the AI without manual clunkiness. Future studies must also prioritize establishing robust, standardized frameworks for validating AI models in diverse clinical settings and for transparently reporting their performance, their limitations, and importantly, their potential biases. This is absolutely vital for building confidence and ensuring reliability in the real world.
And it sounds like the legal and regulatory frameworks also need to evolve alongside the technology.
Precisely. The current regulatory environment, in many ways, wasn't built for dynamic learning AI systems. It's more geared towards static devices. establishing clear, adaptable legal and regulatory guidelines surrounding the development, validation, deployment, and crucially, the accountability for AI in clinical settings is vital. This provides clarity for developers, reassurance for hospitals, and builds clinician trust, encouraging wider adoption without the fear of unforeseen liability down the road.
And the people actually using the technology, the healthcare professionals, they need to be right at the center of this evolution, don't they?
Unquestionably, training and education are a pressing, ongoing need for the future. There must be comprehensive, accessible training programs developed for healthcare professionals across all roles: surgeons, nurses, trainees, technicians, everyone involved in trauma care. These programs need to go beyond just basic software use. They need to enhance general IT literacy and, more importantly, develop a deep understanding of AI's clinical implications, how the tools actually work, how to interpret their outputs correctly, understand their potential failure modes, and critically, know when not to rely on them, when human judgment must override the algorithm. Continuous education is vital because the AI landscape and the tools available will evolve rapidly. Clinicians need to be equipped to evaluate new tools critically and integrate them effectively and responsibly throughout their careers.
And finally, how critical is ongoing collaboration in this future vision? Does that need to change too?
Collaboration remains absolutely fundamental and must, if anything, deepen in the future. Successful, ethical, and impactful deployment of AI in trauma surgery absolutely requires strong, sustained partnerships. Partnerships among the hospitals and healthcare systems implementing the technology, the AI developers actually building the tools, and the academic and research institutions pushing the boundaries of what's possible. Future directions should actively explore innovative models for these collaborations and engaging all the key stakeholders, clinicians from different specialties, IT staff, hospital administrators, patients and their representatives, ethicists, AI developers right from the beginning in the design, testing, and implementation phases is crucial. This helps ensure that the AI systems being built are not just technically sound, but are truly tailored to the specific, demanding, and unique needs of trauma surgery workflows and diverse patient populations. This will significantly enhance their efficacy, their safety, and ultimately their acceptance by the people who need to use them.
So the future really involves pushing the boundaries of AI itself, yes, but just as importantly, diligently dismantling the systemic hurdles to implementation, making substantial investments in training and education for the human element, and fostering deeper, more inclusive collaboration across every single stakeholder group involved.
That is the comprehensive roadmap, essentially outlined in the report, for navigating the path towards fully realizing the transformative potential of AI in this most critical of medical fields.
Well, we've covered a vast amount of ground in this deep dive, guided by the insights from that report: artificial intelligence in trauma surgery, reality, potential, and impact. We've traced the historical roots of AI in medicine and surgery, explored its concrete current applications in everything from knowledge management and workflow optimization to decision support and risk assessment, specifically in trauma. We've detailed the significant, tangible benefits AI can bring, particularly its powerful predictive capabilities and its ability to enhance diagnostic speed. And we've also faced up to the very real, complex challenges that must be overcome: the ethical questions around personalization and trust, the practical barriers of implementation and funding, the persistent issues with data quality and interoperability, the human factors in change management, and that critical need for ongoing training and support. We've also looked at how institutions like St. Michael's and UTSA are putting these concepts into practice right now and seeing the exciting, albeit challenging, future directions for this technology.
It's certainly clear that AI is no longer just some distant concept for trauma care. It's here, it's in development and in early use, bringing powerful new capabilities to the table. But its successful, safe, and, importantly, equitable integration is a complex endeavor that requires careful, collaborative attention to the people, the processes, and the infrastructure involved, not just focusing solely on the algorithms themselves.
Understanding this landscape is truly vital for anyone invested in the future of healthcare, especially in critical care specialties like trauma surgery. It provides a much clearer picture of how technology holds the promise to reshape patient outcomes in the most urgent and challenging medical scenarios imaginable. If you found this deep dive valuable today, please do take just a moment to rate and share this deep dive with someone else you think wants to be well informed about the cutting edge where medicine and technology meet.
Yes, your engagement really does help us bring these complex but important topics to a wider audience.
So here's a final thought for you to perhaps ponder. Building on everything we've discussed today about the incredible potential and also the significant pitfalls of AI in trauma surgery, Given the immense promise of AI to potentially save lives and dramatically improve care in the most urgent situations, but also bearing in mind the profound ethical concerns around data, fairness, and maintaining the human connection in patient care, how do we as a society, not just as clinicians or technologists, ensure that the drive for technological advancement in this critical field always keeps patient trust, equitable access to care, and the fundamental humanity of medicine at its absolute core, guiding exactly how AI is developed and deployed in the future?